On shows like Intervention, we see people destroying their lives with drugs and alcohol. It is heartbreaking to watch and often frustrating, as many of these addicts can't seem to stay on the road to recovery. Our next guest says the first step to helping an addict is understanding how his or her mind works. Dr. Harold Urschel has written a new book, Healing the Addicted Brain, the revolutionary science-based alcoholism and addiction recovery program. He joins us now with more on his bestseller. Dr. Urschel, thanks so much for being here today.
Thank you, Tanya. It's a pleasure.
What prompted you to write this book?
You know, I wrote the book Healing the Addicted Brain mainly to get information out to the patients, to the general public, to their friends and families, that this disease is treatable, and there's so many new revolutionary treatments that are available. Most people don't know about them. Even most treatment programs are not delivering those treatments, and so I want to get that information into the hands of the public to help them become a more educated consumer.
That's fantastic. And you say the first step, because I mean so many of us have either a friend or a relative, someone who has struggled with or is struggling with addiction. I mean, it really is something that touches almost everyone in some way.
Absolutely.
And you say the first step to understanding that person is to understanding that their brain is working differently than ours.
Absolutely. The alcohol and drug addiction is a chronic disease of the brain. All the latest scientific studies over the last 12 to 15 years have shown that without question. And so what that means is alcohol and drugs are actually going into your body, injuring your brain, and that injured brain, in about 5 to 10% of the people that use alcohol and drugs, those are the people that get addicted. Once your brain's injured, then you have this disease, and this disease is going to last probably the rest of your life. The hope is that the real positive thing about the book, if you treat this disease as a chronic disease, if you treat it comprehensively, you have a very high chance of successful recovery.
That's a wonderful, hopeful message for so many people.
Absolutely.
Chances what in the 90% of people who follow the regime come out okay? Or?
Absolutely. And again, this goes back to the National Institutes of Health. They've spent hundreds of millions of dollars a year on looking for new treatments for alcohol and drug addiction, and they find some really cool revolutionary treatments.
That's fantastic. Let's talk about some of these. I understand that there is a drug that can help alcoholics not enjoy alcohol.
Absolutely, and I like to actually call it a medication versus a drug.
Okay.
So a medication called Vivitrol that's out there, that's been recently approved about 3 years ago, and this medication does 3 things. It's specifically for alcoholism. It decreases your cravings for alcohol by 90%. It also keeps you from getting drunk. If you take the medication, it prevents alcohol from causing you any higher euphoria, and it decreases the severity of a relapse. 3 very important things.
Sounds fantastic. And now, why is this not more widely used in I guess, drug rehab or alcohol rehab programs?
Well, it's actually not used really anywhere in the country. Even your primary care physician in general doesn't know about it. Unfortunately, there's not a lot of education out there about alcohol and drug addiction, and that's really why I wrote the book and created the website. The alcohol and drug addiction information, it can save lives. It can save the lives of your loved one, your friend, your coworker, if they just know what are the right treatments to get.
Absolutely. Now, is there any medication in the pipeline right now that might do the same thing for drug addicts?
Absolutely. For prescription drugs, pain pills, heroin, a medication called Suboxone. And the Suboxone is very similar to the Vivitrol for alcoholism. Suboxone specifically for narcotics. But again, it can knock your cravings down to about 0. If you try and use heroin or prescription pain pills while you're on the Suboxone, you don't feel anything, so why take them?
Right.
And again, these medications should all be used in the concert with 12-step programs.
Of course.
And this comprehensive approach. Make sure that you get your psychiatric illness. Many times if you have alcohol and drug addiction, you have depression, anxiety. Those need to be treated. Your family needs to be treated.
So if you or a loved one is battling addiction and is in some kind of 12-step program right now, do you recommend they talk to their doctor about one of these options?
Yes, the most important thing a family could do is get educated about the treatments that are out there through the book, through the website, innerhealth.com. If you can get educated, then they can ask the doctors or the treatment programs, why isn't my loved one on Vivitrol? Why aren't they on Suboxone? What about getting their psychiatric illnesses treated? In addition to the 12-step program, which is a really good program, but if you do just 12 steps by itself, you get about a 30% success rate long term. If you do the comprehensive science-based approach, you have about a 95% success rate.
Well, so aren't those who organize and run these 12-step programs aware of this new science? Are they resistant to it because it's new, or are they starting to incorporate it?
They're just starting to incorporate it, but not as fast as I would like. Most treatment programs were started 20 or 30 years ago before we had all these scientific breakthroughs, and they tend to be resistant and more suspicious of any new treatments other than AA, and that is why I really want the public to actually pull the treatment. By becoming educated, they can pull the treatment providers into the 21st century and say, I want my loved one to get better. I want my loved one to beat this illness. And they can do that if they just have the right information.
And do these medications help speed up the process of recovery, or do they just solidify it?
They actually do both. Some of them will actually keep the alcohol or drugs out of your body so you don't use it, and then the brain by itself can heal on its own.
So what's necessary is a lifelong lifestyle change.
Exactly, like any chronic disease, diabetes, high blood pressure, asthma. That's all alcohol and drug addiction is. It's a chronic medical disease. It happens to be of your brain, whereas asthma happens to be for your lungs, diabetes of your pancreas. So just different organs are affected, and if you treat alcohol and drug addiction comprehensively over the lifespan of the person and don't assume that it's going to go away after 3 months or after one detox or after one treatment, then what you're going to find is you're going to get a 90-95% success rate in many cases, assuming you're getting this comprehensive science-based approach.
It's really wonderful to hear the potential that these new medications hold for those who are struggling with addiction. Doctor, thank you so much for telling us about them today. And for more information on this topic, pick up a copy of Dr. Urschel's book, Healing the Addicted Brain, and you can also log on to enterhealth.com. Don't forget, you can follow ABC News Now on Facebook and Twitter. Just search ABC News Now.